Joining us now is Dr. Shyla Valentine, a cardiologist and a member of the Women for Trump movement. So, Doctor, I want to talk about the idea of a vaccine because that's really the biggest type of relief that a lot of people are kind of looking forward to. That's the thing that could go the furthest way, but a lot of officials say that we may still be a year, maybe even 18 months off. Does that time frame kind of seem what's right regarding this process?
The process of a vaccine many times can take up to years
Yeah.
because it's a multi-phase process. But I think 18 months is probably, if all the stars line up, I think it's optimistic, but I think it can be achieved because, as you know, many companies are in process of developing vaccines. So I think it's encouraging.
No, and that's what we've heard too. So the clinical test would have to take place too, and then of course they would have to go to human testing, stuff like that. And in fact, to your point too, I was looking at the time period of what it takes for other vaccines. Sometimes it could take up to decades, but because of the seriousness of this situation, they've kind of cut the red tape, kind of expedited a lot of this in order to get it done sooner rather than later. But a big thing that's come up regarding that too is the use of drugs such as hydroxychloroquine. That's something that a lot of people are hoping, the anti-malaria drug, that could maybe be used as a treatment for coronavirus. Are those concerns or are those kind of prospects, do you think that they are plausible, or do you think maybe we're going down a rabbit hole that isn't the right one?
Well, I have a particular interest because I'm a pharmacist. I was a pharmacist before I went to medical school, and this drug has been around a long time, so we know that it's safe. And the data really came out of some patients in France that showed some improvement. So I think that the optimism is rooted in some good data, although we don't have our perfect trials. Some
Sure.
of my colleagues are optimistic about it, and I am as well.
And when it comes to using that drug, because you mentioned that it's already on the market for certain uses, would it have to go through new tests in order to get back on the market for coronavirus? Would it have to kind of go through a different procedure? Is it something that maybe comes from an administrative level where they say now you can start applying this to coronavirus? How does it work as far as application goes?
It will undergo the same testing and trials that other drugs do, but as you know, we're seeing some anecdotal benefit, and so the off-label use has been approved, and so tablets are being delivered. So it will go through the normal process of production and testing.
And that's good news because a big part of this too isn't only just saving people who do have coronavirus. That, I mean, of course, that is the end goal. But a big part of what we're being told to do right now regarding social distancing is to level the curve. And I think it's very important for our viewers to know that that doesn't mean eradicating coronavirus. That means containing it to a point where it's not overwhelming our hospitals, to the point where there's not a surge of people going in. And if that drug is a plausible solution, that could help with at least some of those cases. But regarding the hospitals kind of being overrun at the moment, we're not seeing that too much yet, but they are at risk. But that also puts other people who may have heart disease or other surgeries, other things that would also normally be our everyday type of lives and injuries and type of diseases and stuff like that. Now they're being affected because they kind of take a backseat to coronavirus. Is that something that we should be kind of looking forward to, or looking out for, I should say?
Well, I practice cardiology, and so as we all know, heart disease is the number one killer. So I am especially interested in the fact that hopefully people are not smoking more. Hopefully they're not gaining weight because these things will have a deleterious effect on our heart health, and I'm hoping that that's not the case.
And I do want to talk about that a little bit because, for example, wherever this virus goes, the demographics are a little bit different. So we look at Italy, for example, that naturally has an older population. And so therefore, the people who are affected by coronavirus are naturally older individuals. But then we kind of look at other countries. That's not necessarily the same case in South Korea. Of course, old people, senior citizens are more vulnerable to this disease, but it's not exclusively just old people. And we're starting to see that a little bit in the United States, too. I mean, over the weekend, a tragic scenario, a 1-year-old became the first infant to die of coronavirus, a 25-year-old in Southern California once again as well. Are there factors in the United States, such as maybe our high diabetic rate or obesity, that maybe could play a factor regarding coronavirus?
Well, I like the fact that you're highlighting the very important fact that young people do get it, and mostly they do well, but can have serious complications. But as you have pointed out, it's the people that have chronic disease, heart disease, lung disease, immune deficiency that really are the people at risk. And so the the measures to hopefully prevent this virus are really going to have a positive impact, especially with that population.
I think it's important, and I think it's especially important for young people to know that, because not only could they possibly die, as we were saying right there, I don't want to throw up the alarms or anything like that, but more importantly, I think they can also carry it and bring it to loved ones without showing symptoms. It's something that I think really needs to be hammered home, because you could be walking around, going to your parties, whatever it may be, carrying coronavirus and not know it. So I think that's part of the danger. But you are a cardiologist as well, and I want to ask, when people are stuck indoors, when people are being told that they can't go outside for long, extended periods of time, as well as the anxiety and the stress that this causes, does that kind of cause maybe other heart problems or other maybe even mental issues that we should be looking forward to?
I'm concerned about that. I think there's a sense of loneliness and probably some depression and anxiety. And anytime there's a stressful situation, heart attacks can be precipitated. I haven't really seen that
Yeah.
in this area or heard that, but it is a concern.
No, definitely. And I think that we were talking to another doctor too, and they were saying that in times like this, physical health is just as much as important as kind of finding a treatment.